Coronavirus vaccinations, Covaxin versus Covishield versus Sputnik V, what we know so far about their possible outcomes. 1. Covaxin, Covishield and Sputnik V are the three upheld antibodies in India. Sputnik V is the third COVID vaccination to be embraced for use in India, following Covishield, Oxford AstraZeneca, and Covaxin. As the import of the Russian vaccines is in measure, there's as of now a huge load of buzz that incorporates the usage of the neutralizer. From practicality, invulnerability and results, while the three upheld antibodies for use pass on extraordinary benefits in directing the threats of the hazardous COVID, there are some indispensable differences moreover. 2. How does Sputnik V cost against Indian antibodies? The Drugs Controller General of India, DGCI, surrendered emergency use authorization to the Sputnik V neutralizer premise the between-time outcomes of the clinical primers coordinated in Russia, which found that Sputnik V passed on a mind-blowing 91.6% ampleness rate, and high response in checking down reality of the contamination. Conversely, with this present, India's Covaxin, which has been actually found to slaughter against the UK variety disease, is over 81% practical, while Covishield, being used globally, has over 70.4% ampleness, which could be furthermore pushed up to 90%, if parcels are partitioned weeks isolated. 3. Side effects of the antibodies. Any counteracting agent, be it a standard make or a mRNA model, support its working by starting certain safe genetic effects, which are similarly reactogenic in nature. An enormous part of these outcomes, while do resolve shockingly quick, can moreover differentiate starting with one individual then on to the next. The possibility of these outcomes could moreover be unimportantly extraordinary according to one vaccine to another. 4. How do they matter? Not only does observing vaccines results help an individual prep for the hit up until now, anyway, a few outcomes could help one with sorting out what model may be more equipped for an individual, dependent upon his/her prosperity and shortcoming. For example, a person with a higher likelihood of getting blood bunches, or using anticoagulants, may be in an ideal circumstance using a safer counteracting agent, especially when we presently have the choice to single out vaccines. While we believe that Sputnik V will end up being openly available, here's a brief explainer with respect to how the after effects of the Russian immunizer section against Covaxin and Covishield. 5. Side effects of the Russian immune response. Sputnik, developed by the Gamaleya National Center of Epidemiology and Microbiology, Russia, Sputnik V was one of the first enrolled COVID inoculations supported for use all around. The viral vector vaccination works by setting off neutralizer creation and hence, causes routine combustible reactions, by far most of which are delicate in nature. According to a Lancet study circulated in February 2021, the most notable side effects of the immune response include headache, fatigue, pain at the imbuement site, flu-like disorder. Veritable outcomes, or negative reactions, haven't been seen now. As per clinical examinations, there have been events related to hypertension, hemorrhagic stroke, circulatory trouble, yet none of them was found to be related to the immune response imbuement. 6. Side impacts that are ordinary with Covaxin. Covaxin, made and created by Hyderabad-based Bharat Biotech, uses a dormant SARS-CoV-2 antigen strain, or a dead contamination, to set up the immune system to see the sickness later on. Since it is set up in a standard way, it is seen as commonly okay for use and has less outcomes also, interestingly, with mRNA vaccines like Moderna and Pfizer shots. As per the Covaxin assurance sheet and authoritative standards, vaccines changes have shown people getting the going with results. Redness, fever, sweating just as chills, malaise, body hurt, nausea and vomiting, itching and rashes, headache. Those encountering depleting issues, immunocompromised, using blood thinners, pregnant, breastfeeding or with a foundation set apart by overly sensitive reactions to any of the vaccine's trimmings are urged to not take the neutralizer right now. 7. Side effects of Covishield, Oxford AstraZeneca, vaccines. The Oxford AstraZeneca vaccination, which is being used in excess of 62 countries worldwide, has been running into hot waters of late with the divulgence of some offensive outcomes, including blood clusters. While examines exhibited the immunizer to be alright for use and troublesome reactions phenomenal, the most talked about consequences of the Covishield punch resemble Covaxin. Regardless, the power of the outcomes might be imperceptibly more limited. These are the huge outcomes one can expect. Pain at the implantation site, redness, moderate or high fever, drowsiness and slowness, arm strength, body hurt and torture. 8. What might it be a smart thought for you to pick? Given that people have the decisions to book their supported antibodies right now, obtaining prior information about the benefits and likely after effects of the vaccines is a good call to make. That being said, recall that all antibodies underutilized fulfill endorsement and well-being guidelines and similarly successful in forestalling COVID diseases. Henceforth, individuals are encouraged to accept antibody shots as and when one is made free to them.